So basically I'm just gonna do a head to toe assessment on you and just see how you're improving and going along, okay?
Okay.
Okay, so I'm gonna go ahead, I already gathered my supplies, I'm gonna go ahead and wash my hands. I'm going to provide for privacy. Now, are you comfortable?
Yes.
Okay. So patient is sitting upright, well groomed, speech is clear, so no issues with that, okay? So can you tell me your name and date of birth?
Melissa Pinson, 7/14/1989. I
Okay,
forgot.
so check the wristband. So do you know where you're at right now?
Rasmussen,
Okay, and do you know why you're here?
for a health assessment.
Okay, and do you know what date it is?
It is Wednesday, November 23rd, 2016.
Okay, so tomorrow's Thanksgiving, right?
Yes, it
Okay.
is.
So patient is alert and oriented, times 4. Okay, so let's go ahead and get started. So basically I'm just gonna look at your hair right now, okay?
Okay.
So you're not missing any hair. Now, do you color your hair?
Yes.
Okay. Okay, so no lesions, no bumps, no parasites, vermin, all that good stuff, okay? So let's go ahead and check in your ears. Okay. So basically I'm just gonna pull your ear up and back to see your tympanic membrane, which I do see, and it is gray in color, which is normal. Okay. Let's do the other side. Okay, up and back, tympanic membrane is noticed. I don't see any excess drainage, wax, or anything like that. Okay, so go ahead and close your eyes for me. Now, if you hear anything, let me know. And then if so, which ear do you hear it with, okay?
Okay. Left. Right.
Okay, so cranial nerve 8 is intact. Okay, now let's go ahead and close your eyes again. And if you feel anything, just let me know where you're at, okay?
Left cheek. Right cheek. Forehead. Chin.
Okay, perfect. So can you go ahead and smile for me? Frown, puff out your cheeks, lift your eyebrows. Okay, so cranial nerve 5 and 7 are intact. Let's go ahead and look at your nose. Okay, no drainage. Septum is not deviated, so that's a good sign. Go ahead and close one side and sniff. Okay, other side and sniff. Okay, so she is patent, not clogged up or anything like that, so that's good. We're in cold season right now.
I can breathe.
Yes, and that's always a good thing. Okay, so now let's do your eyes. Okay, so I'm just gonna have you follow this pen, okay? Okay. Okay, so now I'm gonna flash the light in your eye. Okay, I'm very sorry. I know it's bright, it's aggravating, but just for a little bit. Perfect. Okay, so your pupils did react to the light, which is another good sign. So now let's go ahead and cover one eye, the same eye I'm covering. Okay, so I'm just gonna move my fingers back and forth and just let me know if you can see it, okay, while you're looking at me.
Okay. Okay. Okay.
Okay.
Okay. Okay. Okay.
Okay, now the other side. Had to adjust.
Yes. Oh, sorry.
That's
Yes.
okay.
Yes. Yes. Okay. Okay. Okay.
Okay, so cranial nerves 2, 3, 4, and 6 are intact. Okay, so now go ahead and open up your mouth for me and say ah. Okay, so mucous membrane is pink in color, tongue is moist, tongue is pink. Go ahead and lift up your tongue. Okay, uvula is symmetrical. So cranial nerves, let's see here, 9 and 10 are intact. Okay, so go ahead and shrug your shoulders. Okay, go ahead and push your cheek against my hand. Okay, good job. So cranial nerve 11 is intact. Okay, so let's go ahead and listen to your heart. Okay, so I am going to the right sternal border, second intercostal space, and this is your aorta. Okay, very loud. Okay, thank you. Okay, so now I'm going to your left sternal border, second intercostal space, and I'm listening to your pulmonic. Okay. Okay, Okay, so now I'm going down to Herb's Point, and this is your third intercostal space, left sternal border. Okay. Thank you. Okay. Okay, so this is the left sternal border, fourth intercostal space, tricuspid. Alright, go ahead and lift up your left breast for me. Thank you. Okay, so this is the mitral valve. This is midclavicular, fifth intercostal space. Okay, so no murmurs or gallops were noted. I did hear your S1 and S2, so that's good. Okay, so now let's go ahead and do your pulses. Okay, so this is your radius. Okay, equal bilaterally. Let's do brachial. Okay, and then I know you have more pulses, I just can't think of them right now. Okay, so let's go ahead and do your popliteal. I'm sorry, my hands are freezing.
It's okay.
Okay, so both of those are present. Okay, let's do your dorsalis pedis. Okay, both of them are present. Okay, let's do, and of course I can't think of these right now, but I will. Okay, so all of your pulses were present, symmetrical, and 2+ bound. Okay. Let's go ahead and check your capillary refill. Okay, so less than 3 seconds with reactivity. And let's go ahead and do your plantar. So I get to play with your feet. Okay, so I'm just going to scrape the bottom of your feet. Just let me know if you can feel it or if you have any issues.
Okay.
Okay, so that's good. And that's good as well. Okay, so I'm going to go ahead and check for edema. Okay, so I would say 1+ for edema. Let's go ahead and check your arms for any edema. No. Okay, your face, and let's look at your back. Okay, so no edema present. Okay, so now let's go ahead and check your lymph nodes. Okay, so submental, submandibular, which I can never pronounce it, tonsillar, pre-auricle, post-auricle, occipital, okay, and then pre-cervical, and then post, and then go ahead and shrug your shoulders, and then submandibular. Okay, so I don't feel anything, so that's good as well. Thyroid. Okay, so thyroid is not enlarged. Go ahead and swallow for me. Okay, so no issues with swallowing, no pain or anything?
No.
Okay. Alrighty, so let's go ahead and do your reflexes. Okay, so go ahead and relax your arm for me. Okay. Okay, so that's your triceps. Okay, and let's go ahead and do your brachial. Okay. Okay, and then let's see here. Again, I can't think of this either, so let's go ahead and do this one. Okay. Okay, awesome. And then I'm gonna go ahead and do your patellar. Stand to the side so you don't kick me. Okay. That was a good one. Okay, so let's go ahead and do your Achilles. Okay. Alright, so all reflexes were present. Okay, so I'm going to go ahead and listen to your lungs. Okay. Now, do you have any shortness of breath?
No.
Or difficulty breathing?
No.
Okay. So I noticed that she's not using any accessory muscles to help you breathe. AP is 1 to 2. Okay. Okay, so I want you to take a deep breath, breathe in and out through your mouth, okay? And if you get lightheaded or anything, just let me know.
Okay.
Okay, go ahead and lift up your arm. Okay, other side. Okay. So go ahead and just bend over and touch your knees for me. Okay. So spine is aligned. Do you have any back pain?
No.
Okay. So let's go ahead and take a deep breath for me. Okay, so symmetrical expansion for the thoracic. Okay, so now unfortunately I get to hit you, so I'm gonna bang on your back. Just let me know if you feel any tenderness,
Okay.
okay?
Nope.
And then all I'm doing right now is just seeing if you have a kidney infection.
Okay.
So let's see here.
No.
No? Okay. Alrighty. So I'm gonna go ahead and listen to your bowels. And that way we can get all that good stuff out of the way, okay? When was your last bowel movement?
This morning.
This morning. Okay. Any issues with that?
No.
Okay. No foul odor or